Hi, everyone. Gilliam Elliott here. Many people assume that outbound medical tourism happens mainly because patients want cheaper treatments in other countries. And the truth is, cost does influence the decision, but it's rarely the only reason that patients travel for medical care. In many situations, patients leave their home country because something in their healthcare system is not meeting their needs. It might be access, it might be timing, it might be specialization. When those gaps appear, patients begin exploring treatment options outside of their borders. Today, we're going to talk about how outbound medical tourism works, what drives patients to seek treatment abroad, and the different pathways patients use to access care in other countries. But before we dive in, take a moment to like the video and subscribe to the channel to learn more about the world of medical travel. If you spend time studying the medical tourism industry, you start to notice patterns in how patients move between countries. People are not randomly choosing destinations. Their decisions are usually influenced by how healthcare systems operate in their home country. Understanding outbound medical tourism begins with understanding the different ways patients travel for healthcare. Outbound medical tourism refers to patients leaving their home country to receive treatment in another country. So what actually drives outbound medical tourism? There are several common factors. One major factor is healthcare system limitations. In many countries, hospitals simply cannot meet patient demand. Operating rooms may be fully booked, specialists may be limited, and patients waiting for certain procedures may face long delays. Long surgical waiting lists are one of the most common reasons patients begin looking abroad for treatment. When someone needs surgery but must wait several months before a procedure becomes available, they may begin researching alternatives in other countries. Another factor involves the concentration of expertise. Over time, some countries develop strong reputations for specific treatments. Hospitals in those locations perform high volumes of certain procedures, and they build specialized programs around them. Patients travel to these medical hubs because they want the most skilled specialists for their medical needs. Outbound medical tourism is not always a sign that a healthcare system is weak. Often it simply reflects where world-class specialization exists. Cost differences between healthcare systems can also influence outbound medical tourism. In some countries, certain procedures are extremely expensive, especially for patients paying out of pocket. When the cost of a treatment is much higher in the patient's home country than in other countries, traveling abroad may make treatment financially possible for the patient. However, cost alone rarely determines the decision. Patients still evaluate safety, surgeon experience, and hospital reputation before choosing where to receive care. Outbound medical tourism occurs across every region of the world, but the patterns vary depending on the healthcare system. For example, patients from the United States often travel to medical tourism hotspots for affordable dental procedures, cosmetic procedures, bariatric surgery, and other major procedures. Patients from Canada and the United Kingdom commonly travel abroad to avoid long wait times for treatments. Patients from different parts of Africa frequently travel to medical tourism hubs in Asia and the Middle East to access highly specialized centers for complex medical procedures. Patients from the Middle East often travel to Europe and Asia for advanced medical technology and specialized care. Patients around the world ultimately choose from many different destinations depending on the procedure, the provider, and the treatment options available. These examples show that outbound medical tourism is not limited to one region. It occurs across many different healthcare systems. Another important part of this discussion is understanding how outbound patient flow actually works. Many people assume patients simply search online, find a hospital, and schedule treatment. And it does happen that way sometimes. But in many cases, there's an entire network supporting the process. Medical tourism facilitators often guide patients through treatment planning. They help patients compare clinics, gather medical records, and coordinate travel arrangements. Referral relationships also exist in this industry. Physicians, agencies, and healthcare organizations sometimes connect patients with hospitals in other countries. In some regions, neighboring countries establish formal healthcare partnerships that allow patients to seek treatment across borders. These agreements create a system where patients can access medical care in a nearby country and have those costs reimbursed by their home country's healthcare system. Some private insurance programs also cover treatment abroad. These plans allow patients to access international hospitals while the insurance company covers the cost of care. Together, these connections create the pathways that allow patients to move between healthcare systems. Outbound medical tourism also influences how the entire industry operates. When patients begin traveling abroad for treatment, hospitals and destination countries begin developing programs designed to serve international patients. These programs often include international patient departments, multilingual staff, and treatment coordinators to assist patients traveling from other countries. Many facilitators also emerge in these countries as organizations begin helping patients evaluate providers, communicate with clinics, and plan treatment abroad. In many ways, inbound medical tourism markets grow because outbound demand already exists. One important insight that professionals should understand is that outbound medical tourism is not simply about patient behavior. It reflects how healthcare systems function. When a healthcare system cannot provide timely access to certain procedures or treatment becomes difficult to obtain because cost or availability, patients begin looking beyond their borders. When regions perform certain procedures far often than others, patients travel there for treatment. Understanding these patterns help explain how global medical tourism operates. What this really shows us is that patient movement across countries follows healthcare system dynamics. Patients travel when access is limited. Patients travel when expertise is concentrated elsewhere. Patients travel when affordable alternatives exist beyond their borders. And recognizing those patterns helps professionals better understand how international patient demand develops. If you're serious about entering this industry and want a structured roadmap for building your company, we've created a certification program that walks you step by step through the process. You can learn more by visiting the link in the description. Thanks for watching, and I'll see you in the next video.